we are back again.
Here we are.
Whether you like it or not.
Dr. Mary Beth Loy. Dr. Pauline.
Dr. Pauline
Shiver.
Did you forget how to say my name, person?
I was trying not to talk over you.
Oh, sorry. I talk over. Well, tonight we are going to talk about surgery. And I think we're going to focus more on the elective side of things versus the unexpected side of things, because not every surgery is planned. But when you do have a planned surgery, there's so many things you can do to prepare for it, to have a better outcome, and just better mental state, better physical state going into it, and then a better outcome.
Well, as with so many things in life, half the battle is planning and preparation. Yeah.
Very, very true.
Visualizing what you want the end point to be, I think.
Agreed. So, I'm going to start with a question for you.
Wait, I was going to say, our approach is going to be, I'm women's health, Pauline does physical therapy, so we are talking probably more from the medical side of things, the physical side of things, and then touch briefly on the mental preparation, because it takes all three if you're going to plan for a successful outcome too.
100%.
Yeah. People can, if they comment a question, if they want to ask a question, we can answer it live. But we
will take any prompt that you want to send our way in with regards to particular surgeries, for sure.
Yes, because we're going to be pretty general, but I think we'll probably touch on a couple specific ones.
More common.
Or like an orthopedic one, female health one.
Oh, but the most common women's health surgery is, actually one of the most common surgeries, period, is a hysterectomy with hold on.
No, not at all. We're there.
Okay, Pauline, you were going to start with the question.
I was going to start this one a little different and put you on the spot and say, you work well under pressure. I was going to say, what would you, going into surgery, because having had surgery yourself,
pick a body part, babe.
What would you say is kind of the most, or would be your, one key point as not a clinician, but as
patient?
As patient.
So, surgery in general.
Mm-hmm. You could pick a specific one, because they're a little different, I will say.
Yeah, let's talk abdominal surgery.
Okay.
So, that could be hysterectomy, that could be cesarean section, if you know you're going to have a planned cesarean section. That can be an appendectomy, any kind of bowel surgery, anytime that they're going to open up or access your abdominal cavity. If you have the luxury of planning for that, and hysterectomies are typically elective, C-sections are typically elective, actually working on all your other strength, especially core strength and leg strength from a stamina standpoint, working on your energy. If you have been a couch potato, don't expect to go through surgery and then get up and run a marathon. But anything you could do to improve your overall fitness from a weight training strength standpoint, you're going to benefit in the long run. You are also going to massively benefit if you have upped your nutritional game, because healing is what the body does really well, but you need to support your body in healing. And that sometimes means front loading from a protein and nutrient standpoint. So vitamins, minerals, hydration. There are also behavioral aspects to preparing for surgery that you may want to indulge in. Exercise, yes, or you might want to avoid things in particular like drug use, cigarette smoking, vaping. All of those actually impede your body's ability to heal itself. And again, your body does a really great job of healing itself if you just provide it with the right foundation. So we don't always have that. You're in a car accident and need surgery. You don't have time to plan and prepare. But if you are ready to, welcome the baby into the world or get your uterus out of the world, you have the luxury of being able to put some good behaviors in place.
100% agree. And are you saying that from a patient standpoint as well?
Yes.
Because I like, if there's a little anecdote or something from one of yours that maybe was surprising. Maybe not.
No, all my babies were C-sections. One was unexpected, still is unexpected to this day. The other two were a little bit more planned, but I would say those two that were more planned, I spent a lot more time kind of trying to be as active as I could, knowing that with surgery comes a little bit of recovery where I was going to be down. And I didn't want to start in a deficit and have to climb out from a big hole.
And did you feel like that was
true?
There
was a definite difference.
You could tell a difference?
Yeah.
Because that's kind of unique that you've had both to be able to say,
absolutely.
I was more prepared versus less prepared.
Well, and then I'll flip the switch, and when I had my rotator cuff surgery, it was elective, but I had been dealing with pain for so long that I don't think I planned and prepared for that one as well as I could have. And I don't know, maybe you can touch on that, what you can do when there's an actual injury that prohibits me from strengthening that joint. How do I plan and prepare for that?
So that's a really good question, because I would say because I was
not
say,
planned, folks.
we just do such a good job.
It's amazing.
I will say that I have limited experience with surgery, but I will say
I know.
from what I do. I mean, I haven't had very many.
Oh, but you.
I mean, I
had
Your one was a
a
big
year
bang.
ago.
I did have a surgery last year, and I will say that for that, I definitely was very prepared for that. I spent a large part. For those of you who do not know, I donated my liver last year, and it was planned. And so I spent the months leading up to it being very active. I did a lot of strength training. I did a lot of cardio, and I went into it just like really taking care of my body as best as I could.
You did gut testing too.
Yep, I
and
did.
ways of
Yep,
seeing
I
what
did.
your deficits were. Yeah.
Yep, I did. I was looking at gut testing. I was looking at like just I think we did some blood work. Yeah, we did some blood work before just to kind of see where I was at, and I had a lot of blood work just from that surgery anyway. But just to know where I was at, and I really worked hard on making sure that I was hitting some better nutrition goals, like you were saying. I was trying
Adequate
to
protein.
Yep, and doing all that, and then but I don't have a lot of experience in the recovery phase of it. But I will say that I felt like I recovered fairly quickly.
You did beautiful.
After a major surgery, I was, walking within, I was in the hospital for a week, and that next week I was already starting to walk around my neighborhood and stuff like that. And then I was back at work, month and a half later doing stuff. So I think I handled it well. But I will say on that note, I only have experience with the abdominal surgery. So I've had my gallbladder out and the liver surgery. That's it. From my experience with patients and being a physical therapist in the orthopedic realm for 20 years, they're very drastically different sensations of pain. I feel like abdominal kind of stuff or organ or internal stuff tends to heal a little faster, and the pain feels a little different. I could be very wrong. But
you can isolate it better. That I would offer
Maybe.
that. You can isolate the abdominal pain better, because if I sit still, I can make it go away, so to speak.
mm,
But I found specifically
Orthopedic,
with
yes.
my rotator cuff, I would have 5 C-sections before I would have another rotator cuff from a discomfort
those are,
standpoint.
yes.
It didn't matter
More
if I
painful.
sat still and had it propped. I still had to breathe, which then moved an appendage.
And I would agree with that. I think the recovery is a lot longer. I think that people aren't as prepared for some of the big mental aspects of having that type of surgery. The physical for sure, particularly if it's a longer interval between when you get injured and you have the surgery, because sometimes it isn't right away. Especially those elective ones, you're not necessarily going to have a rotator cuff tear or something. I think hips, knees, when you have a hip replacement, knee replacement, those sometimes are years in the making, so to speak. So you don't necessarily,
So how do you prepare for that physically?
you do the best you can. You work around the pain or with the pain. So sometimes, you know me, I'm very blunt, and I'll tell people, well, you're not going to hurt it anymore. Like, you're not damaging it anymore. So
Which
you
is the
can
word honest.
push,
Yes.
honest, blunt. So you can push the envelope a little bit to within your comfort level. I mean, obviously you don't want to spend your time miserable, but for instance with yours, you want to move it as much as you can. You want to strengthen anything around it as much as you can and keep that range of motion, because one of the biggest things we see in an orthopedic surgery is what you have going in regard to range of motion particularly is what you're going to get coming out. And so when I see that with a knee or a shoulder, if someone's very restricted, there are certain ranges we want, like a knee replacement, to be able to ambulate up and down stairs without a severe limp. So I want to see a certain amount. If I don't see that going into surgery, I'm often not going to see it afterward, or it will be very challenging to get it back.
Is it harder
So-
to recover if you have a significant amount of atrophy or muscle wasting?
It can be, yes. So that's the strength portion of it, is really trying to do as much as you can to strengthen the joints around, or the muscles around the joint, whatever's going to be worked on. But then cardio is a big part of that, because you're going to heal better if you have the stamina to go through, one, the pain, because it's going to affect your entire body, mentally, and then, the stronger you are, the more mental discomfort you can take as well. So I think it all just plays into that.
So from a musculoskeletal standpoint, is that something you can plan and prep for yourself, or do you think you'd benefit from?
I think there's a little bit of both depending on it. What I'm biased, I think that PT can offer a lot of very directed, targeted approaches that can help mitigate the pain.
So it's not just a ploy for insurance.
No.
Because I know it's an insurance box you have to check before you can ever get scheduled for that
Yes,
surgery.
that is, yes. But I will say, in my experience with that, it's usually a one-time pre-op visit, and they give you a handout and say, here you go, do them. Doesn't mean that they're effective. They're usually kind of a cookie-cutter handout.
As I said, but I think that plays into the people's perception.
Mhm.
Because that was my thought about physical therapy prior to my shoulder was, well, it doesn't work. Why should I try to work it more?
It's a good.
But
That's a fair point.
it was a misperception, not knowing, hindsight, knowing now. But what you're saying is there are actually things that you're not going to fix that joint
No.
with physical therapy,
No.
but you are going to improve your outcome by doing things.
100%. And even just so for instance, if your shoulder
That
is
might
so
have just
bad.
been an aha moment for me.
There you go. I love
A little
that.
late,
A little bit late, but
I love them though. But if you were having, there are some instances where you're not moving that arm. Like if you've got to have a surgery, you may not be able to move it much at all.
Right.
Still does not mean that you can't go in with a physical therapist, have them moving you passively to keep these structures from getting tight and restricting range of motion.
well,
in the
then
surgery.
you're also working on your cardiac stat.
You want to work on your other side. Your legs aren't hurting if your shoulder is, so you can work on your legs because all of that is going to ultimately make you more resilient through the surgery. You're going to do better in surgery, and then you're going to do better out of surgery, and your outcome's going to be better.
Well, so I haven't delivered babies in a long time, but I talked briefly about C-sections and that recovery from that abdominal surgery. But even if you don't know that you're having a C-section, you could look at childbirth as a type of surgery / procedure, not knowing. But I have preached when I did deliver babies, preached to those women on and on about how your health and wellness, certainly going into pregnancy, but certainly during pregnancy, before delivery, impacts how well your delivery goes, how safe your delivery is, and how quickly you're going to get back on your feet, whether that baby comes out with a knife or whether it comes out with a natural vaginal delivery.
And I believe that all plays
But
such a role.
I think a vaginal delivery is more analogous to what you're describing as a orthopedic injury. Because you have to work everything around it. Like you are not.
Yeah,
You're not
there's
dealing
some
with a
things
big
you're
old
not
bone.
doing at 9 months.
Right, there are things you're not doing at 9 months, but you can still work on leg strength. You can still work on core strength, a little bit stretched out, but there are
But you
things
still want to target it.
Yeah.
Safe, and that's another area where I think a lot of people do not or don't know that physical therapists can help very much with pre and postpartum. Because we do have knowledge in that area, and yes, you're right. There's some things you can't do at certain phases.
Well, that's a huge safety concern, right?
Stages of pregnancy, but you also, it's really not good as you seem to be sedentary either, unless you are medically required to. I know there's certain situations where you're not.
That was a broken collarbone.
You're not
Breathing
doing
was
that.
an issue, so I was sedentary. And I will tell you, coming out
But
of that surgery,
it makes a difference. I not just the physical side. I think the mental side too. The stronger my clients that I see going in stronger physically, just have the mental aspect that's just very much a stronger, like going in. I'm just thinking of a client recently that was just positive attitude, and she's like, you know what? I'm gonna do it. I'm ready. And she goes in and did amazing.
Well, and to touch on that mental aspect of things, it's all about your attitude. And so planning and preparation, yes, that is an objective thing that you can do. But in planning and preparing, you also have to get your mind in the right place, educating yourself as to what to expect. Expectations are huge. Surgery hurts. I don't know if that's a newsflash or not, but there is some pain associated with it. But knowing what your expectations are, planning, preparing, get your mind in the right place as far as that positive attitude can take you far. That once you're past that, you're going to be able to move into the wellness and the recovery much more quickly than if you had gone in, being very cynical and jaded about everything that's about to happen.
Well, we did get a question from Emily, who's probably going to practice, but
Thank you, Emily.
I know. She does want to talk about, you guys to talk about the anxiety that a lot of people go in with.
There's no anxiety with surgery.
Well, according to Emily.
Yeah.
No, but any tips, tricks?
Well,
or-
that's not even a plan prepare versus acute. Like, so that's the anxiety is there whether it is an acute issue or whether it is a planned issue, and yes, it is very real. I happen to, and you may come at it from a different realm, I happen to encourage and self-participate in anxiety prevention by educating myself. So knowing first what I can do to be my best self going into that surgery, but also knowing even if it's where do I go in the hospital to check in, what's my surgeon's name, what's the anesthesia look like. For some people that involves YouTubing videos of their surgery. Some people that creates more anxiety. But educating yourself to know what your expectations are can help with that anxiety. Because then as things go according to plan, ideally, there's nothing that's coming at you that you didn't expect.
True, and I totally agree with that, the education component. I would kind of touch on the post-surgical side, coming from the orthopedic, is there can be a lot of rules around what you can and cannot do, or should and should not do. And some of those rules are very antiquated, to put it nicely. They're not what we would necessarily recommend anymore, but there's a lot of education is not done well. I don't always think in the orthopedic realm. So there are many times where I have clients that will come in and they're either told something that's maybe a little older and not necessarily true any longer, or they're not told anything. Or if they're told, it's when they're right out of surgery and you don't remember anything at all. And they don't get, a lot of education. So the education component of it, the afterward, can really help alleviate some of that anxiety.
And that's a matter of, I don't know if that's an appropriate time, but it's a matter of advocating for yourself to get that education both before and after. So to your point, if the only education you were given was when you were looped out on, post-surgery medication, if you didn't understand that, advocate for yourself after that. Just keep asking questions. Yeah, you may annoy some people in the process, but
squeaky wheel gets the grease.
Squeaky wheel gets the grease, and education will be your friend. That's not the end all, and it's not going to get rid of all your anxiety, but I do find that helps. It helped me personally, and I think it helps when I sit down and talk with patients. To this day, I don't do surgeries anymore, but I do pre-surgery counseling for some people, and a lot of that is just making sure that we're all on the same page with what to expect from their surgery.
Right.
Sometimes medication can play a role in anxiety as well.
It can.
I think less likely, honestly, though.
I would agree with that. And I think having good, reputable sources to go to for information too is important.
TikTok is not one of those
No,
sources.
no, TikTok's not. But also knowing that there are some restrictions around it, that there are times like if you can't just go up to anyone in the medical field and ask questions. They can give you some kind of loose guidelines, but if establishing care with someone specific that is working with you is really, really key, because then they know you before surgery, they know you after surgery. They can answer much more specific questions.
Well, I'm bound to give you different pre- and post-operative instructions than I am, a 70-year-old woman who doesn't work out.
They're different. Yes. Yeah. But it's kind of my point being that there are times where we all know a doctor or somebody, but having that close relationship where you've established care can be extremely helpful. Physical therapists, having a relationship, and when I say relationship, that's not just knowing them as a friend, it's having them as your, they've seen you before or after. Just, I always pull it back into the beauty of the out of network and the cash based is you can come to me for whatever you want and establish that care and use that when you need it, because I've established it. I don't have to see you, on a regular basis, or just have it for this one thing.
It's an ongoing conversation, and this is one little obstacle in your life. But if we've been there for the journey, then
I can have a much better. I can speak with you much more specifically about what's going on, and give you much better answers on those things, and that helps alleviate that anxiety too. Is I think just knowing that there's someone there, or having a support network around. Talk to people that have had it. Sometimes there's so much anxiety around the unknown, but if you know a couple people that have had it done and you can hear their experience, sometimes that can calm you down, but not always, because sometimes.
No, I was going to say sometimes that can backfire.
Yes.
You rarely hear about good childbirth stories, but lots of bad childbirth stories.
I guess that's true. Yeah.
But it comes back to having someone an unobjective or an unbiased participant in your healthcare.
Yeah.
Someone that that you vetted and will give you honest answers. Yeah.
But you definitely need to. You need to know what you don't know, and know who you can go to for questions.
Know your limitations.
Because I just keep coming back because ortho is what I know. But I think about some of the rules and guidelines we have around like hips, and people are the doctors are so bad at telling. So there's hip precautions depending on which way they go in. So if they do a posterior approach or an anterior approach, they're slightly different. Mm-hmm. And oh my gosh, they don't tell people that they're not for life. They don't tell them. Like, they're not for life. It's just for a certain period of time while you get stronger until your body can do it. And for these poor people, because they're pretty strict restrictions, I mean, it's so sad. And then I'm going, well, you're so strong. What do you know? You can do that, and it's just it's interesting.
Some of that is the limitations of a traditional practice.
Yes,
there's just
100%.
time constraints.
Yes, and you're not getting that time with your ortho for them to go over. Because it is very individualized. Like, don't get me wrong. The reason they have those restrictions, so thinking of a posterior approach for a hip 90-degree roll is pretty common, meaning you can't flex your hip past 90 degrees. But people don't think about, we think about putting on your shoe or doing this, but it's also bending over to touch something, in bed to pull your sheets. You can't do a lot of those things. But once that muscle's strong enough to support the joint, you can. But that's going to be very unique to a 70-year-old that's been very, very active versus a 70-year-old that's been sedentary.
I think that plays into, back to the planning and preparation, advocating for yourself, adding to that list is because your healthcare, the proverbial your healthcare is so you specific. Go in with lists.
I love a list.
I am that 50-year-old woman who works out X, Y, and Z days during the week. What are my specific limitations? And it's okay to ask that. And if you piss someone off, then that's not the right provider for you. Because that absolutely is information that is going to benefit you, your surgery, and your recovery. Because I think that's where we're moving, is that recovery aspect of things.
I think so, yeah.
And let me tell you, that hospital stay is not your recovery.
No.
Because with insurance limitations, with insurance, with hospital procedures, they're getting you out of there as fast as they can, whether it's an open belly procedure or a orthopedic surgery.
And I can speak very minimally on that side of the PT world. I did have to do it in PT school and did not care for acute care, but it is very much a structured, like, it's almost like a checklist. Can they do this? Can they do this? Then make up, downstairs, go to the bathroom, with the walker, done, you're out.
My favorite after the collarbone was, how many steps into your house?
And then you have to do that many.
I have one, and they said, okay, can you step up? Okay, she's ready to go.
That's what it is. Because
I couldn't breathe.
Yeah, that's what what you get in there. These
Yeah. So your recovery.
It's not recovery in the hospital.
It's not recovery
check a box,
in the
hospital.
Right.
But that's the nature of what it is. It's not meant for that. I mean, that it really isn't. Unless you've got, like, in that PT's case, if they notice something significant, they're going to say so that you don't get discharged too soon.
Right.
But they're not trying. Their goal isn't necessarily to get you recovered. It's just to make sure you get safely out of the hospital and home, and then into your post-surgical rehab outpatient.
Well, I think there were some questions about, like, what would be the expectation, and this is when we would have to talk in generalizations, but what would be some of the expectations for how long before you feel better? I'm going to talk, because it's an easier answer, about abdominal procedures. Typically, if you have an open belly, it's 4 to 6 weeks before you're back to feeling good. Now, that doesn't mean great, but good. 6 to 8 weeks before you're 100%. If you're able to have those abdominal procedures in what the term is minimally invasive, whether they use a laparoscope or a camera, or they're able to do a vaginal approach. Can I say vagina on Facebook?
Sure.
I feel like you can, yes.
Vaginal approach for the hysterectomy. If we can avoid a big old open incision on your belly, that's more like 2 to 4 weeks for feeling good, 4 to 6 weeks to be back to 100%. But that does not mean that you are bedridden for those 2 to 4 weeks. And I think that is a massive misconception on some people's part. That means that you need to, that's when you get your list out and say, what can I do? Well, what were you doing before surgery? And, so if I was walking 5 miles a day before surgery, the idea that 2 or 3 days after surgery I could get up and walk down to the end of my street and back, that's probably pretty, that'd be okay. Now, if I was bedridden for 3 weeks before my surgery, then no, I'm not doing that.
Yeah,
But abdominal surgeries are pretty straightforward. Minimally invasive, 2 to 4. open belly, 4 to 6. Depends a little bit on age. But I'm telling you, in that orthopedic world of yours,
Oh no, that's
all
not.
bets are off.
That's not the same. No, not at all. That so I can say,
Starting
something-
with your finger and then your face.
I was like, it's more like kind of similar though, like minimally invasive, something small. You're gonna recover a lot more quickly. But orthopedic pain is very different type of pain. I think it's like you said, you don't really put yourself in a position to get comfortable. You kind of just ache all the time. It can throb. It just, when you move, it can be sharp. So that stuff can be very
Abdominal pain is not
disconcerting.
weather
No, yes. Joint pain.
weather related.
So I think that can throw some people off too. And I will say that it feels different as well. Like, again, my experiences with more abdominal, I didn't even know that I was in pain when I was in the hospital because I didn't know that's what it felt like. And so I wasn't taking my pain medicine, and then finally it caught up to me, and I was miserable.
But that's the education.
But I
component.
didn't know
Back to the education
because
component.
I'm always like, is it sharp, dull, achy, throbbing, and that is not what it felt like at all.
So so if I'm having a whole knee replaced, what's that recovery
So
look like?
it's very unique. I've had clients that were very healthy, very active going in, recover in 4 weeks. And I say recover, ultimately takes about a year for full recovery, and sometimes up to 2 before you really know where you're at.
But walking back to participating in life.
Yes, she was back, and she was an older woman. She was in great shape. And then 4 weeks, then she went in and had her next one done. Another 4 weeks, she was out.
Ooh,
doing great.
I have a follow-up question.
Mm-hmm.
So do you advocate for one knee at a time or both knees?
I advocate for one at a time.
And
the reason being, but again, it's kind of like you say, sometimes we only see the bad cases or the ones that didn't do well. But anytime I've seen someone that had a bilateral knee replacement, they just didn't. Neither knee did well. Meaning they didn't long term. Meaning they didn't get full range of motion back. Meaning that then that affected their daily life. So if you can't get, like I was saying before, certain degrees of motion, you have trouble getting in and out of certain spaces, chairs,
it would be an
cars.
important question to ask your surgeon, though.
It would be
because
some
it might
will,
be right
it might be right
do.
if you know that you're terrified of surgery and you're not going to go back and get the other one done, and they both need to be done. It might be a great one for you, but then I would say you really need to work.
But your recovery is going to look much different. Your pre and your post are going to look much different.
Yes, because it's going to take a lot longer. So joints are just very variable. But typically 4 to 6 weeks in pretty, I would say, knee replacement, 2 to 4 weeks in pretty significant pain. By 6 weeks, you're usually in more of the achy, like tolerable.
And physical therapy starts
right away.
Right away.
It should.
And so when you're at home, how many outpatient days of physical therapy for a knee?
Meaning like standard
Yeah,
care?
standard.
Usually it's like 2 to 3 times a week.
I mean, I
6
realize
weeks.
that we offer customized
Yes.
plans here,
Yeah.
but in general.
It's been a really long time, but I think it's 2 to 3 times a week. I think it's 3 times a week actually post for the first 4 weeks, and then they kind of adjust from there. Same for hip, but a lot of doctors do not send people after hip replacements. Hip replacements are much easier to recover from. They don't tend to hurt as much. You tend to be mobile a lot quicker. Knees just take. There's a lot more pain involved with the knee, and
which is weird because this is just a hinge joint, and this one goes all over the place. I would think.
No,
I'll be
knees,
shocked.
yeah, they just knees just
So
don't do as well.
So
So doctors
if
do not.
this is 2 to 4 weeks and 4 to 6 weeks for your knee, what is?
I mean, same thing pain-wise. I've actually had some, this is anecdotal, I don't have research on this, but they'll wake up and say, my hip feels better than it did before going in.
Yeah,
so their
I've
pain is
talked to people about
completely different, and they will be off pain medicine in 2 weeks. That's not everybody. I mean, everybody's different. But I will say 2 to 4 weeks for sure with the hip. They're doing better, and then 4 weeks they're wanting to push the envelope with certain things. So hips just do better.
Moving up, shoulders.
Shoulders take probably the longest. Shoulders tend to be one of the hardest surgeries.
Are we
to
on
recover
11
from.
years now?
Well, I think so. They do tend to be one of the hardest, most painful, and most difficult and challenging to recover from. But the shoulder joint is such a unique joint with how much movement it has, and it's not just the shoulder joint that gets affected. The scapula does, which is a whole unique presentation and how you have to treat that. So those tend to take a very.
But not to beat a dead horse, that goes back to education. Mm-hmm. So you would never want someone to enter a shoulder surgery of any kind with the assumption that it's going to be like a knee or a hip. And
No.
2 to 4 weeks you'd be back to okay.
Right.
Like, so again,
yeah,
themes. I love themes.
Yep.
communication, expectations.
Yes.
Yeah.
And this is another one of my areas where I get frustrated with the we've always done it this way kind of care. When I see people coming in 6 weeks in a sling, oh no. There's very limited circumstances where you want to see that.
Hot button.
Yeah, it's just because the faster you start moving, the better your recovery is.
Is that
your
across the board?
Yes, and your body will tell you when it wants to do something or not. So we have these protocols for surgeries and like rotator cuff repair, all these different things. And I used to probably frustrate some of the ortho doctors because I would move it along according to the client being able to do it or not. Because half the time they'd come in at week 3 and we're talking about the sling and they've walked in without the sling on, even though they're supposed to wear it for 6 weeks. And they're like, well, I was fine, I was in the shower. And then they do something, just incidentally reach for something in the clinic. They're past all the restrictions they're on in that protocol. I'm not going to be like, well, you can't do that. So then I meet them where they're at. So I think sometimes the protocols can be a little bit limiting, and so it's nice to have a surgeon that's open to you and your therapist kind of moving at your pace.
I was going to say, actually trusting the therapist to apply their knowledge base.
Yes, because there are some instances where I am going to look at someone and be like, ooh, yeah, we're passive range for the 6 weeks. Like, this is a major surgery, and we really need to watch it. But there's others, like I said, they'll come in, and they're doing stuff at home, or they'll come in, this was like probably 10, I don't even know how many years ago, but just they would come in with it on, but it wasn't even on right, and then you could tell because they whip it off, and then they're doing something, and you catch them, and you're going, you're not doing any of your restrictions at home. Well, no. But you just know they're fine because your body will tell you.
Yeah.
It will tell you if it wants to do that or not. So, but shoulders, I mean, when you're talking time frames, I would say a good 12 weeks before you're really starting to feel more normal.
That was my lift experience as well.
But
so people that are like going by the letter of the law and going slow and stuff, downside to that is that
I do see downsides to that. Following things like precisely based on some piece of paper that has been potentially is 15, 20 years old.
Downsides other than just prolonging your recovery time, or downsides, permanent downsides?
I have seen permanent downsides just
Like?
because, like restricted motion, you don't get full range of motion back.
Interesting.
Which
Because there's a window of time.
There's a window of
in which to
opportunity.
gain that.
Yep. And then if you don't get full range of motion back, you often will not get full strength back because muscles function in a very specific area. So if they're too short, then they don't function well, and if they're too long, they don't function well. So if your joint is supposed to be like this, would be 0 degrees flexion.
Yeah.
I want to be able to move all the way up here. My muscle isn't as strong up here or down here as it is mid-range.
Right.
And so you need to get a certain amount of range of motion. Otherwise, if you're stuck here and you can't bend it any more than that, how strong are you?
Yeah.
If you get stuck in a flexion contracture, meaning you can't extend it, well, you're still not going to be very strong because if you're stuck up here, it's so short.
The biceps like a T-Rex.
Yeah. But does that make sense? Like
Yeah, absolutely.
your muscle's going to function better.
But no, I think that's a good question
Yeah.
because there are people who tend to be just by nature
More
Nervous.
cautious.
very
Cautious,
nervous,
that's
very
the word.
cautious.
Yeah.
Yes, and to know that you beam again, you're back to find someone that you work with that is meeting. I like those words.
Meet you where you're
Meeting where you're at is vitally important, especially if one of your goals is
Oh yeah,
I want this to work like it did.
Not just I want to be able to put a shirt on and wash my hair by myself. If you want to be able to work and just do everything you were.
Mm-hmm.
So yes, I do think there can be some very long standing issues with that. And then the lack of range of motion, lack of strength, then translates to function. I mean, one of the biggest things that I think with knee replacements I see is not being able to comfortably walk downstairs. Because if you don't have a certain amount of knee flexion, no one thinks about this when you feel good. But when you step down, your knee has to bend a certain amount to stay on that step before you walk through. Well, if you don't get that amount of range, you're gonna walk downstairs kind of sideways, or you'll always lead with a different leg. Well, then you get weak. Well, then guess what happens then? You have trouble getting up and down out of a chair. Then you have your fall risk, because as strength declines, you have an increased fall
balance
risk.
becomes an issue.
So it's a cascading effect that we don't always pay attention to. And I think that's where, I like to really look at the big picture and kind of go, these are the things that we really need to focus on pre and post. And then, you and I had a conversation today about is the juice worth the squeeze at a certain point. And there can be some diminishing returns. And we were talking about your shoulder and, can I get that motion back after this long? Yes, you can, but it's how much pain do you want to put yourself in? How long does it take for you to kind of recover from that pain to be able to function well? And then what is that?
And what do I have to do to keep it?
Yeah, what do you have to do to keep it? So there's definitely, that's that. You just have to have that relationship and know what do you want to be able to do and have someone knowledgeable enough to help you get there.
So this brings me to a question that I wish Kim were here to answer, but I think we can muddle through it as best we can. What happens when your recovery does not go? And this could be abdominal surgery, this could be orthopedic surgery. What happens when your recovery doesn't go necessarily as planned and you're at the 6-week mark on a knee and you're not back to normal? How do we address that from a physical standpoint? And I can speak from a medical. It's a little bit more specific medically, so I can't speak in generalizations, but how do we address that from a physical standpoint and how do we address that from the mental health standpoint? Because I think that,
frustration.
to Emily's point about the anxiety, there's anxiety going into a procedure, and then anxiety, frustration, depression, I think is what we see more of from a mental health standpoint in the post-operative or the recovery phase of things.
So I tend to approach that from kind of, what were your expectations and where do you feel like you're not meeting whatever you had planned? So some people do, whether we like it or not, I know I do it, is I go in thinking I'm going to feel X way in this amount of time, and when I don't, it's very frustrating. So kind of what were they expecting?
So, and approaching those expectations prior to, I think is
but
valuable.
Even after, it is very valuable, but if you didn't get to have that conversation, then afterward I will kind of bring up, well, what did you expect? And then I, from, my clinical perspective, can kind of go, well, this is what I typically see, and can either help them go, you're right on track, or you might be a little bit behind, but here's how we're going to address it. And then I help create a game plan, and then I also approach it from the, well, what do you want to be able to do? Like, what is your main thing that is kind of like a non-negotiable that you want to be able to do? Is it get on the floor and play with my grandkids because I want to be able to kneel on the ground? Okay, we're going to work on that. Is it, get horseback riding? Like, what do I want to be able to do? Is it running? Is it something? I want to see how much we can kind of walk them through what that looks like.
Might you adjust based on what those, taking into account partly what the hang up is with your recovery, and then readjusting based on goals
100%.
too.
And then I have, sometimes you have to have the hard conversation of that goal is no longer going to be achievable. Like, sometimes you do have to say you're probably not going to be able to do that. There's never I will never look at someone and say for sure you never will, because I have seen some amazing comebacks for somebody has been told they'll never run again, and man, I didn't think they would, and they did. So I never say that, but it's how much are you willing to put in, and then if you don't reach that goal, what does that look like? So kind of making them start to think, if I can't do that again, what will I be happy with?
Well, and I do feel like from a medical standpoint, there's recovery from surgery, that there's hiccups there, or there's diagnoses that are discovered during a surgery that may change the outcome. I see a valuable role for therapy in there as well. At that point where your expectations are not going to be met.
Yes.
And dealing with that so as not to bash all hope, but to make it so that you are still making forward progress, even if that forward progress is maybe a little to the left or to the right.
Yeah, and you reset expectations, and then have that support network for someone else that's a mental health professional.
We're back to having someone you can have a conversation with.
And having that mental health professional is important.
Well, and that conversation with your medical provider or your physical therapist, and then do we need to bring in a mental health professional? But it all goes back. I am so on top of things tonight.
We have a topic going on.
It all goes back to having someone that you trust to have those open conversations, because if we're not aware of your issues, we can't help you with your issues.
Okay, so here's one for both of you. Since we're talking about elective surgeries, delaying them. Do we have an issue? Do we handle it right away? Is it easier? Is it a smaller surgery? Do we put it off as long as we can? What are the drawbacks to either side?
That's a loaded question.
I know.
Because there's different degrees of elective. Yeah. I don't think those are well defined, but there are different degrees of elective. Is it elective because it needs to be done, but my kid's in a school play, or I don't have time off work until 2 months from now? That kind of elective. If there's truly a need, speaking medically, abdominal surgery, if there's truly a need to have it done, delaying for a short period of time, I think is okay. A long period of time is not, because I think your risk of delaying becomes higher the longer you delay. And again, it's hard because it's specific issues. If I'm talking, or non-specific issues, if I'm talking specifically about, if I'm doing a hysterectomy because I have a woman that has very heavy bleeding, delaying that is not going to help her, and there's actually benefit to getting that uterus taken care of before she depletes herself of her blood supply. If I have a woman that's had pelvic pain and has had pelvic pain for 2 years, delaying that surgery means that she's going to be uncomfortable for a lot longer, but is it going to really impact the consequence or the outcome? No.
Okay.
So it's a harder question to answer. It's probably a little easier to answer with regards to.
One might think, but I can't think anything easy.
We're back to the theme of conversations. Everybody's unique. Find someone you can trust.
And the reason I say that is because I've had my thoughts. I'm always open to, my mind being changed on things like this with research and things like that. So I think
You don't know it all.
I don't. I don't pretend sometimes. But I think we used to always kind of say, oh, put it off for as long as you can with knee replacements and hip replacements and things like that. More specifically, the joint replacements, not so much an acute rotator cuff tear or something like
You
that.
don't have to do, though, that, you got a good 10 years on this knee and 5
So,
years on this
yes,
hip.
there was the thought of they only last a certain amount of time, and then so you're gonna have to have another one, and we can only do 2 because you in a lifetime. And I don't think much of that's true anymore. For a lot of the evidence is showing they last 20 plus years. I actually just read
so much.
it has, and I just read because total hip replacements are notoriously told they can never run again. Because of the pounding, and even knees are you should never run again. That's not true. I actually was reading some research done that showed there was actually no damage. There was nothing happened to the knee or the hip when you resumed long distance running.
The mechanical
after.
knee or the hip. Is there any issue with
Potentially
the surrounding
yes, there could
native
be,
tissue?
That's where you need to come see me for gait analysis to fix those things, because yes,
See me
if you're
And my number
compensating,
Pause now for a commercial break.
that's my plug. But a gait analysis from someone. I'm just saying, I'm here. But yes, the compensations can create a lot of up the chain, down the chain, but it doesn't affect that joint.
Yeah.
It's not going to wear it out sooner. People didn't have more pain. It didn't become unstable. All the things they were told before did not happen.
But you said that word compensation, which I
Yes,
think plays a role in deferring surgery.
It does. So I would say I used to say that. There are still instances where, you were saying, okay, you're going to be a little uncomfortable, but it's not really going to do any more damage. So we used to immediately jump on ACL surgeries. Let's get them in right away.
I remember that.
Well, research coming out of Australia has shown that a fully torn ACL can repair itself.
Really?
If you give it enough time. Took 2 years with a lot of rehab, but they didn't have to have surgery.
So you have to be committed.
Yes. So so what are your goals? If it's an immediate return to sport, I'm probably going to tell you to get back in there, but then I'm also going to tell you the reality of there's a lot of different things that can go wrong, and you may not get back to sport like you were, and it's never going to feel the same. So now I'm starting to kind of waver onto do we really need to rush it? But I think that so I've got mixed feelings on maybe yes, maybe no. Your knee arthritis isn't going to get better. Is it probably going to get worse? Sure. But also don't go by your image, because I've seen plenty of knees that were told they have the knees of a 90-year-old and have no pain whatsoever. And I've seen perfectly beautiful knees on x-ray that were in so much pain they ended up having surgery. So you can't go by that either.
That goes back to the independent.
So
pain
I tend to
situation.
base my answer for that kind of stuff on, what are you not able to do now? How much is that impacting your life? And are you willing to continue living the way that you're living without having the surgery, or is it impacting you so much that you feel like you need to go ahead and do it?
We're back to a conversation.
Yeah. And that's not something that I think happens a lot of times in orthopedics, and I'm not bashing orthos. They don't really have the time
No,
to
because they're not
discuss
some
that.
time. They're sitting there with a hammer and ready to fix the problem.
And yes, and
Right.
that's their role is
It's
to
what
fix
they
it.
do.
It's what they do. That's what you go see.
And we're
them.
very thankful that they can do what they
Exactly.
do.
Exactly. So it's not them. I don't. It's more on us as the consumer, because you're consuming a product. You're going to get help of educating yourself. and making sure that you understand your options and
So it's time now for my PSA.
okay.
Never, ever, ever feel bad about looking for a second opinion.
100%.
Ever, never. And it doesn't matter whether that's medical, musculoskeletal,
Yes.
why did I
Any-
not say that word?
Uh-huh.
Orthopedic, whatever. Never, never, never feel bad about getting a second opinion.
I'm a huge proponent of that because you may get different things, and not all surgeons are great. Like not all orthos are great at every type of surgery.
Right.
Like learn, ask, and a lot of them will tell you this is my specialty, or they don't do certain ones, but you want to make sure you find the surgeon that's right for.
I would also
for that.
suggest
That joint.
that if you found your surgeon because they have a beautiful garden in your neighborhood and you've admired it, that might not be the best.
That's not your PSA, is it?
No, my PSA is always get a never feel bad about a second opinion.
And
You don't
I-
always have to get one, but never
I'm a
feel
huge
bad
proponent
if
of
you.
that. Because I've seen plenty of instances where one surgeon's, advocating for surgery, and the other's like, no, do this, and successful outcomes.
Well,
So,
that's why I
mean,
bring my
it's-
PSA up at this point, because you asked what should be a very straightforward question, but it's not, because
Yeah.
there are so many factors that you have to take into account for.
But even my aha moment is talking about this, and even my kind of like, oh, you're right. I don't have a standard answer to any of these questions because I'm like, well, and what? So
I knew tonight's topic was going to be tricky.
it is tricky. It was
I
trickier
love
than
tricky.
But I kind of came in. I came into it kind of thinking it was going to be a little more straightforward, but no, it is very nuanced with the person and the surgery and what their thoughts are around it and how they're taking care of themselves before.
I was
after.
gonna say, I think we have some overarching guidelines though.
Education.
Education, conversation.
Conversation.
No, be at your whatever that is for you, but be at your best physical self
Yeah.
going into a surgery.
Mhm.
Number one, yes, would we agree?
Absolutely.
Number two, plan and prepare
As best you can.
as best you can.
And I would even argue prepare for a bad outcome, prepare for a good outcome. Don't fixate on it. But
Which is
prepare
number
for
three,
both.
which is evaluate your expectations.
Yes.
Be
Go in,
realistic.
yeah.
Yeah, be realistic and know that you gotta have a fluid plan.
And be honest with yourself too. I mean, it's hard to be honest with ourselves, but I say that like going into it, if you haven't been very active for a long time and don't have the expectations it's going to be that easy, because it's not. It just, the truth is it's not.
No, just from the physical
yeah.
strain, stress on your body, it's not going to be easy.
It isn't. It's hard. It takes a while to heal. Pain medication is great and all, but it can mess up some other areas in your body.
And conversely, to flip that, if you are a marathon runner with the expectation you're going to have some surgery, whatever that surgery may be, and be back to running marathons, you might be back. Abdominal surgery, I'll stay in my wheelhouse. Marathon runner, abdominal surgery, why can't I run it 2 weeks? Well, because you're going to delay your recovery by another 6 to 8 weeks if you don't give your body the proper time to heal. Because
And,
again, your body's going to do it.
yeah,
You
it will.
support it, your body will fix itself.
Yes,
pretty
100.
cool.
Yeah, it will.
I love that. I think you guys did great.
We
Thanks,
tried.
Brenda.
And our next one, next month, ooh, I'm excited.
What are we talking about next month?
You'll see.
We don't even get to know, guys.
Stay
Just so you'll know, we don't always know. Sometimes.
Probably better that way.
I gotta get you to show up, I can't tell you.
But as always, we're going to be putting this up on the Elite Rehab and Performance YouTube channel. So you can find us there if you want to check back or
You need help
Or-
sleeping at night.
Yeah,
tune
reach-
in.
And then if you do have any questions, please make sure to reach out to us. We are happy to answer them afterward, and we're always up for a conversation. So we'll talk.
Message our page, message
I was
your
gonna say
Yeah.
wellnessforwomen.plc.com. There's an email there if you have questions for me or if you want to schedule a visit. I like to talk.
EliteRehabandPerformance.com. Saying we can answer your questions, get you in for a consultation, talk about what we need to talk about. But we're here for you guys.
Yeah.
Whatever you need.
Perfect. Thank you so much.
Until next